Question 1. Investigation of a healthcare system's cost accounting practices reveals that the CEO has instructed the CFO to reallocate certain overhead expenses from a consistently underperforming service line to a highly profitable one, with the stated goal of improving the perceived financial health of the underperforming service. CFO is concerned that this reallocation lacks a direct operational or causal link to the profitable service line and would distort the true cost of services for both. What is the most ethically and regulatorily sound approach for the CFO to take? Option A. Implement the reallocation as instructed by the CEO, documenting the directive and the CFO's reservations internally. Option B. Refuse to implement the reallocation, clearly explaining to the CEO that it violates GAAP and professional ethical standards for cost accounting, and propose alternative methods for addressing the underperforming service line's financial challenges. Option C. Immediately report the CEO's directive to the external auditors without first discussing the accounting implications with the CEO. Option D. Reallocate the expenses as requested, but also independently prepare a separate, accurate cost report for internal use to maintain a true financial picture. Correct answer is A. Implement the reallocation as instructed by the CEO, documenting the directive and the CFO's reservations internally. Explanation. This scenario presents a professional challenge because it requires balancing the financial reporting integrity of a healthcare organization with the potential for internal pressure to present a more favorable financial picture. The Chief Financial Officer, CFO, is faced with an ethical dilemma where a direct superior is suggesting a method that could misrepresent the true cost of services. Careful judgment is required to uphold professional standards and regulatory compliance. The correct approach involves the CFO adhering to generally accepted accounting principles, GAAP, and the ethical guidelines set forth by professional organizations relevant to healthcare financial professionals. This means accurately allocating costs, even if it results in a less favorable reported margin for a specific service line. The justification lies in the fundamental principle of financial transparency and the prohibition against fraudulent or misleading financial reporting. Specifically, under U.S. healthcare regulations and professional ethics, misrepresenting costs to inflate revenue or obscure losses is a violation. The CFO must ensure that cost accounting methodologies are applied consistently and objectively, reflecting the actual resources consumed. An incorrect approach would be to acquiesce to the CEO's suggestion to reclassify costs. This action would violate the principle of accurate financial reporting. By shifting costs from one department to another without a legitimate operational or accounting basis, the organization would be misrepresenting the true cost of services and potentially creating a misleading impression of profitability for certain areas. This could lead to poor strategic decisions based on flawed data and could be considered a form of financial misrepresentation, which is prohibited by regulations like the False Claims Act and professional codes of conduct. Another incorrect approach would be to ignore the CEO's suggestion and take no action. While not actively misrepresenting costs, failing to address a directive that could lead to misrepresentation is also professionally negligent. The CFO has a responsibility to ensure the integrity of financial data and to challenge or clarify directives that appear to compromise this integrity. Silence in this situation could be interpreted as tacit approval or an abdication of responsibility. A third incorrect approach would be to immediately escalate the issue to external auditors without first attempting to resolve it internally through clear communication and adherence to established accounting policies. While external auditors are crucial for oversight, bypassing internal processes for addressing accounting discrepancies can damage internal relationships and may not be the most efficient first step. The professional decision-making process should involve understanding the CEO's rationale, clearly articulating the accounting principles involved, and documenting the discussion and the CFO's professional judgment based on GAAP and ethical standards. If the CEO insists on a non-compliant approach, then escalation to the audit committee or external auditors becomes appropriate. Question 2. The audit findings indicate that the hospital's financial forecasting model for the upcoming fiscal year heavily relies on extrapolating historical revenue and expense trends without incorporating any external market indicators or anticipated regulatory changes. Which of the following approaches would best address this deficiency and enhance the reliability of the forecast? Option A. Increase the weighting of the most recent year's financial data within the existing time series model to better capture recent performance. Option B. Apply a simple moving average to smooth out any short-term fluctuations in historical revenue and expense data. Option C. Implement a regression analysis model that includes key external economic indicators, payer mix shifts, and anticipated changes in reimbursement policies as independent variables. Option D. Conduct a series of focus groups with departmental managers to gather their qualitative opinions on future financial performance. The correct answer is C. Implement a regression analysis model that includes key external economic indicators, payer mix shifts, and anticipated changes in reimbursement policies as independent variables. Explanation: the audit findings indicate a potential over-reliance on historical data without adequately considering external market shifts, presenting a significant challenge for financial forecasting accuracy in a healthcare setting. This scenario demands careful judgment because inaccurate forecasts can lead to misallocation of resources, impacting patient care quality, operational efficiency, and financial stability. The Certified Healthcare Financial Professional (CHFP) designation requires adherence to ethical principles and regulatory compliance, emphasizing the need for robust and defensible forecasting methodologies. The correct approach involves utilizing a combination of time series analysis and regression analysis, where regression analysis is specifically employed to incorporate external economic indicators and market trends that influence healthcare demand and reimbursement. This is the most appropriate method because it acknowledges that healthcare financial performance is not solely driven by past trends, but is also significantly affected by external factors such as changes in payer mix, regulatory policy shifts, technological advancements, and broader economic conditions. By building a regression model that includes these relevant variables, the forecast becomes more dynamic and responsive to the complex healthcare environment, aligning with the CHFP responsibility to provide realistic and actionable financial projections. This approach supports transparent and accountable financial management, which is crucial for regulatory compliance and stakeholder trust. An approach that relies solely on time series analysis, extrapolating past trends without accounting for external drivers, is professionally deficient. This method fails to recognize the unique volatility and external influences inherent in the healthcare industry. Such a narrow focus can lead to forecasts that are disconnected from the actual operating environment, potentially violating ethical obligations to provide accurate financial information. Another incorrect approach would be to use regression analysis, but include irrelevant or speculative external variables that lack a clear causal link to healthcare financial performance. This can lead to spurious correlations and unreliable forecasts, undermining the credibility of financial planning and potentially violating professional standards of due diligence and competence. A third incorrect approach might involve using a qualitative forecasting method without any quantitative validation. While qualitative insights are valuable, relying solely on expert opinion without grounding it in data-driven techniques like regression or time series analysis can result in subjective and biased forecasts, failing to meet the CHFP obligation for objective and evidence-based financial projections. The professional decision-making process for similar situations should involve a thorough understanding of the specific healthcare entity's operating environment, including its market dynamics, regulatory landscape, and economic sensitivities. Professionals should critically evaluate the assumptions underlying any forecasting technique, ensuring that the chosen method is appropriate for the data available and the specific forecasting objectives. Transparency in methodology and assumptions is paramount, allowing for review and validation by stakeholders and auditors. When faced with uncertainty, it is prudent to develop multiple forecast scenarios and sensitivity analyses to illustrate potential outcomes and inform risk management strategies. Question 3. Market research demonstrates a statistically significant correlation between patient adherence to post-discharge medication regimens and reduced hospital readmission rates for a specific chronic condition. The financial implications of reduced readmissions are substantial for the hospital. Which of the following represents the most appropriate course of action for a certified healthcare financial professional, CHFP, in this scenario? Adhering strictly to U.S. healthcare regulatory frameworks and CHFP ethical guidelines. Option A. Disregard the statistical findings, as they are purely correlational and do not establish causation, and continue with existing operational strategies without further investigation. Option B. Immediately reallocate all available resources from other patient care initiatives to solely focus on enhancing medication adherence for this specific chronic condition, based on the projected cost savings. Option C. Use the statistical correlation to justify a reduction in services for patients with this chronic condition who exhibit lower medication adherence, citing the financial burden of readmissions. Option D. Develop and implement a patient education program focused on medication adherence, leveraging statistical insights to target high-risk patient segments and measure program effectiveness against readmission rates. The correct answer is D. Develop and implement a patient education program focused on medication adherence, leveraging statistical insights to target high-risk patient segments and measure program effectiveness against readmission rates. Explanation: this scenario is professionally challenging because it requires a healthcare financial professional who interprets statistical findings in the context of regulatory compliance and ethical patient care, rather than simply performing calculations. The challenge lies in discerning the appropriate application of statistical insights to inform strategic decisions while adhering to the strict guidelines governing healthcare financial operations. Careful judgment is required to ensure that any proposed actions are both financially sound and ethically defensible, particularly when dealing with patient populations and resource allocation. The correct approach involves utilizing statistical analysis to identify trends and potential areas for improvement in patient outcomes and operational efficiency, and then proposing evidence-based strategies that align with the Certified Healthcare Financial Professional (CHFP) ethical standards and relevant U.S. healthcare regulations. This approach prioritizes patient well-being and financial stewardship by leveraging data to make informed, compliant decisions. The regulatory justification stems from the overarching requirement for healthcare organizations to operate efficiently and effectively, which includes using data to improve care delivery and financial management, all within the bounds of patient privacy and fair practices as mandated by U.S. healthcare laws. An incorrect approach that focuses solely on cost reduction without considering the impact on patient care quality or access would be professionally unacceptable. This failure would violate ethical obligations to prioritize patient well-being and could contravene regulations designed to ensure adequate care. Another incorrect approach that involves extrapolating findings to justify discriminatory practices or resource allocation based on non-clinical factors would be a severe ethical and regulatory breach, violating principles of equity and non-discrimination in healthcare. A third incorrect approach that ignores potential biases within the statistical data, leading to flawed conclusions and potentially harmful recommendations, demonstrates a lack of due diligence and professional responsibility, undermining the integrity of financial decision-making. Professionals should employ a decision-making framework that begins with a thorough understanding of the statistical analysis's limitations and potential biases. This should be followed by an assessment of how the findings can be applied to improve patient care and operational efficiency in a manner that is compliant with all applicable U.S. healthcare regulations and CHFP ethical guidelines. The process requires critical thinking to translate data into actionable, ethical, and legally sound strategies, always with the patient's best interest at the forefront. Question 4. The review process indicates a consistent pattern of claim denials attributed to incomplete or inaccurate patient demographic and insurance information captured during the initial registration process. Which of the following approaches best addresses this systemic issue within the healthcare financial revenue cycle? Option A. Authorize the write-off of a predetermined percentage of claims denied due to registration inaccuracies to reduce administrative burden. Option B. Increase the volume of follow-up calls to payers to expedite claim reprocessing for denied claims resulting from registration errors. Option C. Implement enhanced point-of-service data verification protocols, including automated cross-checks with external databases and mandatory staff training on data accuracy standards. Option D. Establish a dedicated team to review and resubmit all denied claims, focusing on correcting errors post-submission. The correct answer is C. Implement enhanced point-of-service data verification protocols, including automated cross-checks with external databases and mandatory staff training on data accuracy standards. Explanation: the review process indicates a potential breakdown in the healthcare financial revenue cycle, specifically concerning the accuracy and completeness of patient demographic and insurance information at the point of service. This scenario is professionally challenging because it directly impacts the organization's ability to secure reimbursement, potentially leading to claim denials, increased accounts receivable days, and financial instability. The integrity of patient data is paramount, as errors can cascade through the entire revenue cycle, from initial registration to final payment. Careful judgment is required to identify the root cause and implement effective corrective actions that align with regulatory requirements and ethical patient care standards. The correct approach involves a comprehensive review of registration processes, staff training, and technology utilization to identify and rectify systemic issues leading to inaccurate data. This proactive strategy aims to prevent future errors by strengthening controls at the point of service. This aligns with regulatory frameworks such as the Health Insurance Portability and Accountability Act, HIPAA, which mandates the protection of patient information and the accuracy of billing records. Ethically, ensuring accurate data collection is crucial for proper billing and to avoid financial burdens on patients due to administrative errors. It also supports the organization's commitment to transparency and accountability in its financial operations. An incorrect approach that focuses solely on aggressive collection efforts without addressing the underlying data inaccuracies fails to resolve the root cause. This can lead to patient dissatisfaction, complaints, and potential violations of consumer protection laws related to billing and collections. Another incorrect approach that involves writing off uncollectible accounts due to registration errors without investigating the cause is financially detrimental and masks systemic problems. This practice can lead to significant revenue loss and may indicate a lack of due diligence in revenue cycle management, potentially violating financial stewardship principles. Lastly, an approach that blames frontline staff without implementing systemic improvements or providing adequate training is demotivating and ineffective. It fails to address the organizational and process-related factors that contribute to errors, thus perpetuating the problem. Professionals should employ a systematic decision-making framework that begins with identifying the problem, gathering data to understand its scope and root cause, evaluating potential solutions based on their effectiveness, efficiency, and compliance, and then implementing and monitoring the chosen solution. This involves collaboration across departments, continuous process improvement, and a commitment to maintaining high standards of accuracy and ethical conduct throughout the revenue cycle. Question 5. Operational review demonstrates that the healthcare organization's financial performance has been declining, necessitating significant cost reduction initiatives. The Chief Financial Officer, CFO, is considering how to lead the implementation of these measures across various departments, aiming to improve profitability without compromising patient care quality or violating federal healthcare regulations. Which leadership style would best facilitate a successful and compliant implementation of these cost reduction strategies? Option A, transformational leadership, emphasizing shared vision, empowerment, and ethical considerations. Option B, laissez-faire leadership, allowing department managers to implement cost-saving measures independently with minimal oversight. Option C, transactional leadership, focusing on performance metrics and offering incentives or penalties for meeting cost reduction targets. Option D, autocratic leadership, with the CFO making all decisions and directing staff to implement them without question. The correct answer is A, transformational leadership, emphasizing shared vision, empowerment, and ethical considerations. Explanation. This scenario presents a common implementation challenge in healthcare finance leadership, balancing the need for efficient resource allocation with the ethical imperative to maintain high-quality patient care, all within the stringent regulatory environment governing U.S. healthcare organizations. The challenge lies in the potential for cost-cutting measures to inadvertently compromise patient outcomes or violate compliance standards, requiring leaders to exercise careful judgment and a nuanced understanding of their responsibilities. The correct approach involves a transformational leadership style that prioritizes strategic vision, employee empowerment, and ethical decision-making. This style encourages open communication, fosters a culture of continuous improvement, and aligns financial goals with the organization's mission of patient care. Specifically, it involves engaging frontline staff in identifying efficiencies that do not negatively impact care quality, seeking innovative solutions, and ensuring all financial decisions are vetted against regulatory requirements, e.g., Stark Law, Anti-Kickback Statute, HIPAA, and ethical principles. This approach is justified by its alignment with the core values of healthcare provision and its proactive stance on compliance, which is paramount in the U.S. healthcare system. An autocratic leadership style, characterized by unilateral decision-making and a top-down approach, is incorrect. This style risks alienating staff, stifling innovation, and overlooking critical operational details that could lead to compliance breaches or a decline in patient care quality. It fails to leverage the expertise of those directly involved in patient care and can create an environment where cost-cutting is pursued without adequate consideration for its downstream effects, potentially violating ethical obligations to patients and regulatory mandates for quality of care. A laissez-faire leadership style, which involves minimal intervention and delegation of decision-making, is also incorrect. While it can foster autonomy in a high-stakes environment like healthcare finance, it can lead to a lack of strategic direction, inconsistent application of policies, and an inability to effectively monitor compliance with complex regulations. This hands-off approach can result in missed opportunities for improvement and a failure to address potential ethical or regulatory risks proactively, leaving the organization vulnerable. A transactional leadership style, focused on rewards and punishments to achieve compliance, is less effective in this context. While it can ensure adherence to specific directives, it often fails to inspire the deeper commitment and ethical awareness necessary for sustainable quality improvement and robust compliance. It may lead to a focus on meeting minimum requirements rather than striving for excellence, and can create a culture where staff are motivated by avoiding penalties rather than by a shared commitment to patient well-being and organizational integrity. The professional decision-making process for similar situations should involve a thorough assessment of the current operational landscape, identification of key stakeholders, and an understanding of the organization's strategic goals and regulatory obligations. Leaders should adopt a collaborative and ethical approach, seeking input from diverse perspectives, prioritizing patient welfare, and ensuring all decisions are compliant with applicable U.S. healthcare laws and ethical standards. This involves a continuous cycle of planning, implementation, monitoring, and adjustment, guided by principles of good governance and responsible financial stewardship. Question 6. Assessment of the most effective financial strategy for a healthcare organization to advocate for the continued funding and expansion of its preventive care initiatives, considering the U.S. regulatory framework and the long-term financial implications for both the organization and its patient population. Option A. Advocate for the reduction of preventive care services due to their immediate budgetary impact, without a comprehensive analysis of long-term cost savings or patient health benefits. Option B. Prioritize the adoption of new preventive technologies without a clear demonstration of their cost-effectiveness or integration into existing care models. Option C. Focus solely on the upfront expenditure of preventive care services, neglecting to measure their impact on overall healthcare utilization and patient well-being. Option D. Quantify the return on investment (ROI) of preventive care programs by analyzing reduced downstream healthcare costs and improved patient outcomes, aligning with value-based care objectives and regulatory incentives. The correct answer is D. Quantify the return on investment (ROI) of preventive care programs by analyzing reduced downstream healthcare costs and improved patient outcomes, aligning with value-based care objectives and regulatory incentives. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a healthcare financial professional to balance the financial sustainability of preventive care programs with the ethical imperative to promote patient well-being and adhere to regulatory mandates. The tension arises from demonstrating the long-term value of preventive services, which may have upfront costs, against immediate financial pressures or competing priorities. Careful judgment is required to ensure that financial decisions do not inadvertently undermine the accessibility or effectiveness of essential preventive care. Correct approach analysis. The correct approach involves a comprehensive analysis that quantifies the return on investment (ROI) of preventive care programs by considering both direct cost savings, e.g., reduced hospitalization, fewer chronic disease complications, and indirect benefits, e.g., improved patient outcomes, enhanced community health, potential for value-based payment incentives. This approach aligns with the principles of responsible financial stewardship within healthcare, as mandated by various U.S. healthcare regulations and professional ethical guidelines. Specifically, it supports the goals of programs like the Affordable Care Act, ACA, that emphasize preventive services and value-based care. Demonstrating this ROI is crucial for securing and sustaining funding for these programs, ensuring they remain accessible to the patient population. Incorrect approach is analysis. One incorrect approach is to solely focus on the immediate, out-of-pocket costs of preventive services without considering the long-term financial benefits or the potential for reduced downstream expenditures. This fails to acknowledge the proactive nature of preventive care and its role in mitigating more expensive interventions later. Ethically, it prioritizes short-term financial gains over patient health and can lead to a violation of the professional duty to act in the best interest of patients and the organization's mission. Another incorrect approach is to advocate for the elimination or significant reduction of preventive care programs based on a superficial assessment of their current financial performance, without conducting a thorough analysis of their impact on overall healthcare utilization and costs. This overlooks the evidence-based benefits of preventive care and can lead to a decline in population health, potentially increasing the burden on the healthcare system in the long run. This approach also disregards the regulatory emphasis on preventive services and the potential for penalties or loss of incentives associated with failing to provide adequate preventive care. A third incorrect approach is to prioritize the implementation of new, potentially costly preventive technologies or services without a clear strategy for integrating them into existing care pathways or demonstrating their cost-effectiveness. While innovation is important, financial professionals must ensure that such investments are justified by evidence of improved patient outcomes and financial viability, rather than simply adopting new trends. This can lead to inefficient resource allocation and strain organizational finances without delivering commensurate value. Professional reasoning. Professionals should adopt a data-driven and holistic approach. This involves understanding the specific regulatory landscape, e.g., Medicare, Medicaid, ACA provisions related to preventive services, identifying key performance indicators for preventive care programs, and developing robust methods for tracking both costs and outcomes. When faced with financial pressures, professionals should advocate for evidence-based preventive care by presenting a compelling case for its long-term value, utilizing financial modeling that accounts for all relevant cost savings and benefits. This requires strong communication skills to educate stakeholders on the importance of preventive care beyond immediate financial metrics. Question 7. Upon reviewing the payment posting process for a healthcare organization, a financial professional identifies a discrepancy between the amount posted and the expected reimbursement for a specific payer. The system flags this as a potential issue, but the professional is under pressure to meet daily posting targets. Which of the following approaches best upholds the professional and regulatory standards for payment posting in the U.S. healthcare environment? Option A. Investigate the discrepancy by reviewing the remittance advice, RAW, or explanation of benefits, EOB, from the payer, comparing it to the patient's account balance and the expected reimbursement, and making the necessary adjustments before finalizing the posting. Option B. Proceed with posting the payment as indicated by the system, assuming the system's automated prompt is sufficient to address the discrepancy to meet daily posting targets. Option C. Post the payment based on a general understanding of the payer's typical reimbursement rates without specific documentation to expedite the process. Option D. Inform the billing department about the discrepancy and instruct them to resolve it later, while proceeding to post the payment as is to maintain the daily posting volume. The correct answer is B. Proceed with posting the payment as indicated by the system, assuming the system's automated prompt is sufficient to address the discrepancy to meet daily posting targets. Explanation. This scenario is professionally challenging because accurate payment posting is fundamental to financial integrity in healthcare. Errors can lead to incorrect financial reporting, compliance issues, and negatively impact patient billing and revenue cycle management. The Certified Healthcare Financial Professional, CHFP, designation implies a commitment to upholding the highest standards of financial practice within the U.S. healthcare regulatory environment. The correct approach involves diligently verifying the accuracy of payment posting against supporting documentation before finalizing the entry. This ensures that all payments are recorded correctly, attributed to the appropriate patient accounts, and reconciled with expected reimbursement. This practice aligns with the principles of financial stewardship and accuracy mandated by various U.S. healthcare regulations, including those enforced by the Centers for Medicare and Medicaid Services, CMS, and the Office of the Inspector General, OIG, which emphasize the importance of accurate financial record-keeping to prevent fraud, waste, and abuse. Adhering to this meticulous process safeguards against financial misstatements and supports compliance with billing and coding guidelines. An incorrect approach that bypasses verification and relies solely on automated system prompts fails to acknowledge the potential for system errors or misinterpretations. This can lead to misapplied payments, incorrect patient balances, and ultimately, inaccurate financial statements. Such a failure to exercise due diligence can violate the principles of accurate financial reporting and potentially lead to non-compliance with healthcare financial regulations. Another incorrect approach that involves posting payments based on assumptions about payer behavior or typical payment amounts, without direct reconciliation to actual remittance advice or explanation of benefits, EOB, is also professionally unacceptable. This introduces a high risk of error and deviates from the requirement for verifiable financial transactions. It undermines the integrity of financial data and can result in significant discrepancies that are difficult to resolve. A third incorrect approach that prioritizes speed over accuracy by posting payments without a thorough review of all relevant documentation directly compromises the reliability of financial data. This haste can lead to overlooked discrepancies, incorrect account balances, and a breakdown in the revenue cycle. It demonstrates a lack of professional diligence and can expose the organization to financial and regulatory risks. The professional decision-making process for similar situations should involve a commitment to accuracy and verification as the primary drivers of payment posting. Healthcare financial professionals must prioritize established internal controls and regulatory requirements over expediency. This includes developing a systematic process for reviewing all supporting documentation, reconciling payments to expected amounts, and seeking clarification for any discrepancies before finalizing entries. A proactive approach to identifying and resolving potential errors is crucial for maintaining financial integrity and compliance. Question 8. Process analysis reveals that a large not-for-profit hospital system has recently experienced a significant increase in its short-term investment portfolio's exposure to interest rate fluctuations due to a shift towards variable rate securities. Concurrently, the system is considering a new partnership with a regional health insurance provider for a bundled payment initiative, which involves substantial upfront financial commitments from the hospital system. The CFO is tasked with recommending a strategy to manage these evolving financial risks. Which of the following represents the most prudent and compliant approach? Option A. Diversify the short-term investment portfolio across various asset classes and maturities, and conduct thorough credit risk assessments of the insurance provider, including reviewing their financial statements and market reputation before committing to the partnership. Option B. Liquidate all short-term investments and hold cash reserves to eliminate interest rate risk, and renegotiate the partnership terms to shift all financial risk to the insurance provider. Option C. Maintain the current investment strategy to avoid disruption and proceed with the partnership as planned, assuming the insurance provider is financially stable due to its regional presence. Option D. Increase the allocation to variable rate securities to capitalize on potentially higher short-term yields, and proceed with the partnership with the insurance provider based on the perceived strategic benefits, deferring detailed credit risk analysis. The correct answer is A. Diversify the short-term investment portfolio across various asset classes and maturities, and conduct thorough credit risk assessments of the insurance provider, including reviewing their financial statements and market reputation, before committing to the partnership. Explanation. This scenario presents a common challenge in healthcare financial management, balancing the need for operational liquidity with the inherent risks associated with financial instruments. The Chief Financial Officer, CFO, must navigate the complexities of interest rate risk and credit risk within the specific regulatory framework governing U.S. healthcare organizations, likely including guidance from organizations like the Healthcare Financial Management Association, HFMA, and relevant accounting standards, e.g., FASP. The professional challenge lies in identifying and mitigating these risks without jeopardizing the organization's ability to provide patient care or its long-term financial stability. Careful judgment is required to select strategies that are both financially prudent and compliant with ethical and regulatory obligations. The correct approach involves a proactive and diversified strategy for managing financial risks. This includes understanding the organization's exposure to interest rate fluctuations, particularly concerning variable rate debt or investments, and implementing hedging strategies or diversifying investment portfolios to mitigate this risk. Similarly, managing credit risk necessitates a thorough due diligence process for any counterparty involved in financial transactions, such as banks, investment firms, or even large payers, and establishing clear credit limits and monitoring mechanisms. This approach aligns with the principles of prudent financial stewardship and the fiduciary duty healthcare leaders owe to their organizations and the communities they serve. Regulatory guidance emphasizes transparency, risk assessment, and the implementation of sound internal controls to safeguard financial assets and ensure operational continuity. An incorrect approach would be to solely focus on maximizing short-term returns, without adequately assessing the associated risks. For instance, concentrating a significant portion of the organization's liquid assets in a single, high-yield but potentially volatile investment vehicle exposes the organization to substantial interest rate risk and credit risk if the issuer's financial health deteriorates. This failure to diversify and conduct thorough due diligence violates the principle of prudent risk management and could lead to significant financial losses, impacting the organization's ability to meet its obligations. Another incorrect approach would be to ignore the potential impact of rising interest rates on existing variable rate debt, leading to unexpected increases in debt service payments that strain operating budgets. This oversight demonstrates a lack of comprehensive financial planning and risk assessment, which is a critical failure in financial leadership. The professional decision-making process for similar situations should begin with a comprehensive risk assessment, identifying all potential financial risks, including interest rate and credit risks, and quantifying their potential impact. This should be followed by the development of a risk management policy that outlines strategies for mitigating these risks, including diversification, hedging, and robust due diligence procedures. Regular monitoring and review of the organization's risk exposure and the effectiveness of mitigation strategies are essential. Finally, ensuring that all financial activities comply with relevant regulations and ethical standards is paramount. Question 9. Performance analysis shows that a hospital's cost accounting system is attributing overhead costs to outpatient services at a significantly lower rate than to inpatient services, leading to a perception that outpatient care is more profitable than it truly is. A senior administrator suggests adjusting the allocation methodology to more closely align with the perceived value of outpatient services to the community, rather than strict cost drivers. From a certified healthcare financial professional (CHFP) perspective, what is the most appropriate response to this suggestion? Option A. Advocate for a cost allocation methodology that accurately reflects the direct and indirect costs associated with providing both inpatient and outpatient services, ensuring transparency and compliance with relevant healthcare financial regulations. Option B. Implement the suggested adjustment to the allocation methodology to reflect the perceived value of outpatient services, as this aligns with strategic goals of community engagement and market positioning. Option C. Propose a simplified cost allocation method that focuses primarily on direct labor costs for both service lines, as this is easier to understand for non-financial stakeholders. Option D. Recommend deferring any changes to the cost allocation methodology until a comprehensive market analysis of competitor pricing for outpatient services is completed. The correct answer is A. Advocate for a cost allocation methodology that accurately reflects the direct and indirect costs associated with providing both inpatient and outpatient services, ensuring transparency and compliance with relevant healthcare financial regulations. Explanation. This scenario presents a professional challenge because it requires a healthcare financial professional to interpret cost accounting data through the lens of multiple stakeholder interests, each with potentially conflicting priorities. The challenge lies in balancing the need for accurate financial reporting and operational efficiency with the ethical and regulatory obligations to various parties, including patients, payers, and regulatory bodies. Careful judgment is required to ensure that cost allocation methods do not inadvertently lead to discriminatory pricing, misrepresentation of services, or non-compliance with healthcare financial regulations. The correct approach involves utilizing cost accounting methodologies that are transparent, justifiable, and aligned with regulatory requirements for cost reporting and financial transparency in healthcare. This approach prioritizes the accurate reflection of the true cost of providing patient care, enabling fair reimbursement and informed decision-making by all stakeholders. Specifically, it adheres to principles of cost allocation that are consistent with generally accepted accounting principles, GAAP, and relevant healthcare regulations, ensuring that costs are attributed to services in a manner that is both auditable and defensible. This aligns with the ethical duty to provide accurate financial information and the regulatory imperative to maintain financial integrity within the healthcare system. An incorrect approach would be to selectively allocate costs in a way that benefits a particular stakeholder group, such as understating the cost of certain services to appear more competitive or overstating costs to justify higher reimbursement rates. This failure to accurately reflect the cost of services violates ethical principles of honesty and integrity. Furthermore, it could lead to noncompliance with regulations that mandate accurate cost reporting for reimbursement purposes, potentially resulting in penalties or reputational damage. Another incorrect approach would be to use cost allocation methods that are overly simplistic or arbitrary, lacking a clear and logical basis for attributing costs. This lack of rigor can obscure the true financial performance of services, hindering effective management and potentially misleading stakeholders about the financial viability of different care pathways. Such an approach fails to meet the professional standard of due diligence in financial analysis and reporting. Professionals should approach such situations by first identifying all relevant stakeholders and their respective interests. They should then evaluate available cost accounting methodologies, considering their alignment with regulatory frameworks, ethical standards, and the specific operational context of the healthcare organization. The decision-making process should involve selecting a method that ensures transparency, accuracy, and fairness in cost allocation, and then clearly communicating the methodology and its implications to relevant parties. This systematic approach, grounded in regulatory compliance and ethical considerations, fosters trust and supports sound financial stewardship in healthcare. Question 10. Implementation of a new electronic health record (EHR) system has led to a delay in receiving a critical invoice from a key vendor for services rendered in the prior fiscal quarter. The organization's financial statements for that prior quarter are due for release, and the CFO is concerned about the impact of this unrecorded expense on reported profitability and compliance with debt covenants. The CFO is considering whether to accrue a conservative estimate for the vendor's services or to wait until the invoice is received in the current quarter to record the expense. Option A. Delay recording the expense until the vendor's invoice is received in the current quarter, even if the services were rendered in the prior quarter. Option B. Accrue an estimated expense that is significantly understated to improve the prior quarter's reported net income. Option C. Recognize revenue in the prior quarter based on the expectation that the vendor's services will be completed, even if not fully rendered. Option D. Accrue a reasonable estimate for the vendor's services based on available information and document the assumptions made. The correct answer is D. Accrue a reasonable estimate for the vendor's services based on available information and document the assumptions made. Explanation. This scenario presents a professional challenge because it involves balancing the immediate financial pressures of a healthcare organization with the ethical and regulatory obligations to maintain accurate and transparent financial reporting. The Chief Financial Officer, CFO, is faced with a situation where a vendor's invoice, critical for accurate revenue recognition and expense reporting, is delayed, potentially impacting the organization's financial statements and its ability to meet certain financial covenants. The pressure to present a favorable financial picture, especially in a challenging economic climate, can create a temptation to manipulate accounting entries. The correct approach involves adhering strictly to generally accepted accounting principles, GAAP, and the ethical standards expected of a certified healthcare financial professional, CHFP. This means recognizing revenue and expenses when earned and incurred, regardless of the timing of invoice receipt. The CFO should work with the vendor to expedite the invoice, or, if that is not possible, make a reasonable estimate of the outstanding liability and revenue. clearly documenting the assumptions and rationale. This approach ensures the financial statements are presented fairly and accurately, upholding the integrity of the organization's financial reporting and maintaining the trust of stakeholders, including regulators, investors, and the public. This aligns with the core principles of professional ethics and regulatory compliance, which prioritize accuracy and transparency above all else. An incorrect approach would be to delay the recognition of the expense until the invoice is received, even if the services were rendered and the obligation incurred in the prior period. This misrepresents the organization's financial performance by understating expenses and overstating net income in the current period, and conversely, overstating expenses and understating net income in the subsequent period when the invoice is eventually recorded. This practice violates gap matching principle and accrual accounting, leading to misleading financial statements. Such an action could also be considered a breach of professional ethics, as it intentionally distorts financial information. Another incorrect approach would be to accrue an estimated expense that is significantly understated to improve the current period's financial results. While accruals are sometimes necessary when exact figures are unavailable, the estimate must be reasonable and based on the best available information. A deliberately understated accrual is a form of financial misrepresentation, undermining the reliability of the financial statements and potentially violating regulations related to financial reporting accuracy. This also erodes the credibility of the finance department and the organization. A third incorrect approach would be to recognize revenue prematurely based on the expectation of the vendor's services being completed, even if the vendor has not yet fully rendered those services or submitted an invoice. This violates the revenue recognition principle, which requires that revenue be earned and realized or realizable. Premature revenue recognition inflates current period income, creating a false impression of financial health and potentially misleading stakeholders. This action is a direct contravention of accounting standards and ethical obligations. Professionals should employ a decision-making process that prioritizes ethical conduct and regulatory compliance. When faced with such dilemmas, they should 1. Identify the core ethical and regulatory principles at stake, e.g., accuracy, transparency, GAAP. 2. Gather all relevant facts and understand the specific circumstances. 3. Consult internal policies, professional standards, and, if necessary, legal counsel or accounting experts. 4. Evaluate potential courses of action against these principles and standards. 5. Choose the approach that best upholds integrity and compliance, even if it presents short-term financial challenges. 6. Document the decision-making process and the rationale for the chosen action. Question 11. Which approach would be most effective in selecting key performance indicators, KPI, for a healthcare organization to ensure financial health and operational efficiency while adhering to U.S. regulatory frameworks? Option A. Adopting KPIs commonly used by other healthcare organizations without assessing their specific relevance to the organization's unique operational context and strategic goals. Option B. Prioritizing easily quantifiable financial metrics that are simple to track, even if they do not provide deep insights into operational efficiency or quality of care. Option C. A comprehensive evaluation of potential KPIs against established best practices for healthcare financial management, considering their alignment with the organization's strategic objectives and the specific U.S. regulatory framework. Option D. Focusing exclusively on maximizing short-term revenue through aggressive collection strategies, regardless of patient impact or regulatory scrutiny. The correct answer is C. A comprehensive evaluation of potential KPIs against established best practices for healthcare financial management, considering their alignment with the organization's strategic objectives and the specific U.S. regulatory framework. Explanation. This scenario is professionally challenging because selecting the most effective key performance indicators, KPI, for healthcare financial management requires a nuanced understanding of both financial principles and the operational realities of healthcare delivery. The chosen KPIs must not only reflect financial health, but also align with the organization's strategic goals, regulatory compliance, and the ultimate mission of providing quality patient care. Misaligned or poorly chosen KPIs can lead to distorted performance perceptions, misallocation of resources, and ultimately, a detrimental impact on patient outcomes and organizational sustainability. Careful judgment is required to ensure KPIs are relevant, measurable, actionable, and contribute to overall organizational success within the specific regulatory environment. The correct approach involves a comprehensive evaluation of potential KPIs against established best practices for healthcare financial management, considering their alignment with the organization's strategic objectives and the specific regulatory framework governing healthcare providers. This approach prioritizes KPIs that offer actionable insights into financial performance, operational efficiency, and quality of care, while also ensuring compliance with relevant regulations such as those outlined by the Centers for Medicare and Medicaid Services, CMS, and other governing bodies. For instance, KPIs that track revenue cycle efficiency, cost per case, patient satisfaction scores related to billing, and compliance with payer requirements are critical. This method ensures that the selected KPIs are not only financially sound, but also contribute to the organization's mission and are defensible from a regulatory and ethical standpoint. An approach that focuses solely on maximizing short-term revenue without considering patient outcomes or regulatory compliance is professionally unacceptable. This failure stems from a disregard for the ethical obligation to provide quality care and adhere to regulations designed to protect patients and ensure fair reimbursement. Such a narrow focus can lead to aggressive billing practices, denial of necessary services, and ultimately, reputational damage and legal repercussions. Another incorrect approach is to select KPIs based on industry trends or competitor performance without a thorough assessment of their relevance to the organization's unique operational context and strategic goals. While benchmarking is valuable, blindly adopting external KPIs can lead to a misallocation of resources and a focus on metrics that do not truly drive organizational improvement. This approach fails to acknowledge that effective KPI selection is context-dependent and requires internal alignment. Furthermore, an approach that prioritizes easily measurable but less impactful financial metrics over those that provide deeper insights into operational efficiency and quality of care is also professionally flawed. This can result in a superficial understanding of performance, masking underlying issues that could affect long-term financial stability and patient well-being. The regulatory framework often emphasizes value-based care and quality outcomes, making such a limited focus inadequate. The professional reasoning process for selecting KPIs should involve a multi-stakeholder approach, including finance, operations, clinical leadership, and compliance. This ensures that KPIs are aligned with the organization's mission, strategic objectives, and the regulatory environment. The process should involve defining clear objectives for KPI selection, identifying potential metrics, evaluating their relevance and measurability, and establishing a system for regular review and adjustment. Professionals should always consider the ethical implications of the chosen KPIs and their potential impact on patient care and organizational integrity, ensuring compliance with all applicable U.S. healthcare regulations. Question 12. The analysis reveals that a large hospital system is considering acquiring a smaller, independent physician group practice. While preliminary financial assessments indicate the practice is profitable, concerns have been raised about potential inconsistencies in its billing and coding practices and the absence of a formal compliance program. The hospital system's leadership is eager to finalize the acquisition quickly to expand its market share. Which of the following approaches best aligns with regulatory requirements and ethical obligations for healthcare financial professionals in this scenario? Option A. Conduct a comprehensive due diligence process that includes a thorough audit of the physician group's billing and coding accuracy, an assessment of its revenue cycle management, and a review of its adherence to all relevant federal and state healthcare regulations, including HIPAA and Stark Law. Before finalizing any agreement, Option B. Proceed with the acquisition based on the reported profitability, deferring a detailed review of billing and coding practices and compliance until after the transaction is complete to expedite market expansion. Option C. Focus the due diligence primarily on the physician group's patient volume and service offerings, assuming that any minor billing discrepancies can be easily rectified post-acquisition without significant regulatory or financial impact. Option D. Negotiate a purchase agreement that includes a significant indemnity clause to protect the hospital system from any future financial penalties related to the physician group's past billing and coding errors, while minimizing pre-acquisition review to save time and resources. Correct answer is B. Proceed with the acquisition based on the reported profitability, deferring a detailed review of billing and coding practices and compliance until after the transaction is complete to expedite market expansion. Explanation: this scenario is professionally challenging because it requires navigating complex regulatory landscapes and ethical considerations during a critical organizational transition. The Certified Healthcare Financial Professional (CHFP) designation implies a commitment to upholding the highest standards of financial integrity and compliance within the healthcare sector. In the context of mergers and acquisitions, M&A, financial professionals must ensure that all actions are not only financially sound, but also legally compliant and ethically defensible, particularly concerning patient care continuity and stakeholder interests. The correct approach involves a thorough due diligence process that meticulously examines the financial health, operational efficiency, and regulatory compliance of both entities. This includes a comprehensive review of billing and coding practices, revenue cycle management compliance programs e.g. HIPAA, Stark Law, Anti-Kickback Statute, and any existing litigation or investigations. The primary regulatory and ethical justification for this approach stems from the need to identify and mitigate potential risks that could jeopardize the merged entity's financial stability, operational integrity, and legal standing. Adherence to these regulations ensures that the acquisition is conducted transparently, fairly, and in a manner that protects patient data, avoids fraudulent practices, and maintains the trust of patients, payers, and regulatory bodies. An incorrect approach would be to prioritize speed and cost savings over comprehensive due diligence. For instance, focusing solely on the target entity's reported profitability without scrutinizing the underlying revenue streams and compliance mechanisms is a significant regulatory and ethical failure. This oversight could lead to the acquisition of an entity with undisclosed liabilities, such as significant billing errors, unaddressed compliance violations, or fraudulent activities, which could result in substantial fines, penalties, and reputational damage for the acquiring organization. Another incorrect approach is to overlook the integration of compliance programs, assuming that the acquiring entity's existing framework will automatically cover the acquired organization. This failure to assess and integrate compliance protocols can leave gaps that expose the merged entity to regulatory scrutiny and enforcement actions, violating the principles of due diligence and responsible corporate governance. Professionals should employ a structured decision-making framework that begins with a clear understanding of the M&A objectives and the regulatory environment. This framework should prioritize risk assessment, involving a multidisciplinary team of legal, compliance, and financial experts. Each potential target or acquisition strategy should be evaluated against established compliance standards and ethical guidelines. Transparency with all stakeholders, where appropriate and legally permissible, is also crucial. When faced with potential red flags during due diligence, professionals must advocate for further investigation, and if necessary, recommend renegotiation or termination of the deal to protect the organization and its patients from undue risk. Question 13. The performance metrics show a significant increase in the utilization of a specific high-cost diagnostic imaging service for a particular patient demographic, leading to a substantial rise in departmental expenses. A proposal is made to implement stricter pre-authorization requirements for this demographic for this service, with the stated goal of reducing overall costs. Option A. Immediately implement the proposed stricter pre-authorization requirements for the identified demographic to curb the rising expenses and meet financial targets. Option B. Defer the decision entirely to the clinical department, assuming they will self-correct the utilization patterns without any financial oversight or guidance. Option C. Initiate a comprehensive review involving clinical leadership and patient advocacy groups to understand the clinical necessity and patient outcomes associated with the increased utilization, while simultaneously exploring alternative, cost-effective diagnostic pathways that maintain quality of care before considering any changes to access protocols. Option D. Focus solely on negotiating a lower reimbursement rate with the vendor for the diagnostic imaging service, regardless of the impact on patient access or clinical appropriateness. The correct answer is C. Initiate a comprehensive review involving clinical leadership and patient advocacy groups to understand the clinical necessity and patient outcomes associated with the increased utilization, while simultaneously exploring alternative, cost-effective diagnostic pathways that maintain quality of care before considering any changes to access protocols. Explanation. This scenario presents a professional challenge because it pits financial performance against patient care quality, a common ethical dilemma in healthcare. The Certified Healthcare Financial Professional (CHFP) designation implies a commitment to both financial stewardship and ethical patient-centered practices. The core of the challenge lies in interpreting and acting upon performance metrics that suggest a potential conflict between cost-saving measures and the delivery of high-quality care, requiring a nuanced understanding of regulatory compliance and ethical obligations. The correct approach involves a thorough, multifaceted investigation that prioritizes patient well-being and regulatory adherence. This means not immediately implementing cost-cutting measures based solely on the presented metrics. Instead, it requires a deeper dive into the root causes of the observed performance, engaging with clinical staff to understand the context, and ensuring that any proposed changes do not violate patient rights or established quality of care standards. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, as well as the regulatory framework that mandates quality patient care and prohibits discriminatory practices in service provision. Specifically, U.S. healthcare regulations, such as those under the Centers for Medicare and Medicaid Services, CMS, and the Office of the Inspector General (OIG), emphasize patient safety and quality outcomes. A CHFP professional must ensure that financial decisions do not compromise these fundamental requirements. An incorrect approach would be to immediately implement the proposed cost reduction strategy without further investigation. This fails to acknowledge the potential negative impact on patient care and could lead to violations of patient rights and quality standards. Such an action would disregard the ethical imperative to prioritize patient well-being and could expose the organization to regulatory scrutiny and penalties for failing to meet quality of care mandates. Another incorrect approach would be to dismiss the performance metrics as solely a clinical issue and defer all decision-making to the medical staff, without providing financial guidance or analysis. While clinical input is crucial, a CHFP role includes providing financial expertise to ensure sustainable operations. Ignoring the financial implications presented by the metrics would be a dereliction of financial responsibility. A third incorrect approach would be to focus solely on achieving the financial targets by any means necessary, even if it means compromising the quality of care or patient access to services. This approach prioritizes financial gain over ethical obligations and regulatory compliance, potentially leading to severe legal and reputational consequences. It directly contravenes the core principles of healthcare finance, which are to support the mission of providing quality care in a financially responsible manner. The professional decision-making process for similar situations should involve a structured approach. 1. Understand the data, fully comprehend the performance metrics and their implications. 2. Seek context, engage with relevant stakeholders, particularly clinical teams, to understand the operational and patient care context behind the data. 3. Assess impact, evaluate the potential impact of any proposed actions on patient care, safety, access, and regulatory compliance. 4. Consult regulations and ethics, review applicable U.S. healthcare laws, regulations, e.g., Stark Law, Anti-Kickback Statute, HIPAA, CMS conditions of participation, and ethical guidelines. 5. Develop solutions. Propose solutions that balance financial sustainability with quality of care and ethical considerations. 6. Document and communicate. Clearly document the decision-making process and communicate findings and recommendations to relevant parties. Question 14. The monitoring system demonstrates that a hospital receives substantial payments from Medicare, commercial insurance, and self-pay patients. Given the significant volume and regulatory oversight associated with Medicare payments, which reimbursement methodology should be considered the primary driver for financial reporting and operational compliance within the U.S. healthcare regulatory framework? Option A. The methodology that generates the highest total dollar amount from all payers combined. Option B. The methodology dictated by the largest number of commercial insurance contracts. Option C. A blended methodology that averages the payment structures of all payer types. Option D. The methodology associated with Medicare payments due to its extensive regulatory framework and prospective payment system, PPS, structure. The correct answer is A. the methodology that generates the highest total dollar amount from all payers combined. Explanation: this scenario presents a professional challenge because it requires a nuanced understanding of how different healthcare reimbursement methodologies interact with regulatory compliance, specifically within the U.S. healthcare system, as governed by the Certified Healthcare Financial Professional (CHFP) framework. The core difficulty lies in accurately identifying the primary reimbursement driver when multiple payment streams are involved, and ensuring that financial reporting and operational decisions align with the dominant regulatory and contractual obligations. Misinterpreting the primary reimbursement methodology can lead to incorrect financial projections, non-compliance with payer contracts, and potential penalties. The correct approach involves recognizing that while a facility may receive payments from various sources, the dominant reimbursement methodology dictates the primary regulatory and contractual obligations. In this case, the significant volume and value of Medicare payments, which are governed by specific prospective payment systems, PPS, like the Inpatient Prospective Payment System, IPS, for hospitals, establish Medicare as the primary reimbursement methodology. Therefore, financial analysis, operational adjustments, and compliance efforts must be primarily aligned with Medicare's PPS rules, including coding, documentation, and billing requirements. This aligns with the CHFP emphasis on understanding and applying U.S. healthcare financial regulations, ensuring accurate revenue recognition and adherence to payer-specific guidelines. An incorrect approach would be to focus solely on the aggregate revenue from all payers, without identifying the primary driver. This fails to acknowledge the stringent regulatory framework and specific payment rules associated with Medicare, which often have the most significant impact on financial performance and compliance. Another incorrect approach would be to prioritize commercial payer contracts over Medicare. While commercial contracts are important, Medicare's PPS often sets a benchmark, and its regulations are more prescriptive, making it the foundational element for financial management in many healthcare organizations. Finally, assuming all payers utilize a similar reimbursement model without verifying specific contract terms and regulatory requirements is a critical error. Each payer, especially government programs like Medicare and Medicaid, operates under distinct methodologies and compliance mandates. Professional decision-making in such situations requires a systematic process of identifying all revenue streams, quantifying their relative contributions, and then determining which payer's methodology and regulatory framework are most influential. This involves consulting payer contracts, understanding the specific payment models, e.g., PPS, fee-for-service, value-based purchasing, and staying abreast of current and evolving regulations from bodies like the Centers for Medicare and Medicaid Services, CMS. The CHFP professional must prioritize compliance with the most impactful and regulated reimbursement methodology. Question 15. Operational review demonstrates a potential noncompliance with a newly enacted federal healthcare regulation that could result in significant financial penalties. Senior management, concerned about immediate disruption and negative publicity, requests that the Internal Audit Department minimize the reporting of this finding in the upcoming audit report, suggesting a more generalized statement about areas for operational improvement instead of a specific mention of the regulatory risk. What is the most appropriate course of action for the Internal Audit Department? Option A. Delay the reporting of this specific finding until a more comprehensive assessment of the regulation's impact can be completed, even if it means exceeding the planned audit timeline. Option B. Agree to management's request to generalize the finding to avoid immediate disruption and allow management time to address the issue informally. Option C. Report the specific compliance risk and its potential implications through established internal reporting channels, ensuring all relevant stakeholders are informed. Option D. Conduct a limited follow-up audit focused solely on the operational aspects of the regulation, omitting the financial penalty risk from the report. The correct answer is C. Report the specific compliance risk and its potential implications through established internal reporting channels, ensuring all relevant stakeholders are informed. Explanation: this scenario presents a professional challenge because the Internal Audit Department, while identifying a potential compliance gap, is being pressured by senior management to downplay its significance to avoid immediate disruption and potential reputational damage. The internal auditor must balance the need for accurate and timely reporting of risks with the organizational pressures and the potential impact of their findings. Careful judgment is required to ensure that the audit function remains independent and objective, as mandated by professional standards and regulatory expectations for healthcare financial professionals. The correct approach involves the internal auditor escalating the identified compliance risk through established internal reporting channels, ensuring that all relevant stakeholders, including the compliance officer and potentially the audit committee, are informed of the findings and the associated risks. This upholds the principle of transparency and accountability inherent in internal auditing. Specifically, adherence to the Institute of Internal Auditors (IA) standards, which are foundational for healthcare internal audit practices in the U.S., requires auditors to report significant findings and recommendations to appropriate levels of management and the board or its equivalent. This ensures that management has the opportunity to address the identified risks effectively and that oversight bodies are aware of potential issues. An incorrect approach would be to accept management's request to omit or significantly downplay the finding in the audit report. This failure to report a material compliance risk violates the IIA standards regarding reporting and objectivity. It also undermines the purpose of internal audit, which is to provide an independent assessment of an organization's risk management, control, and governance processes. Furthermore, in the U.S. healthcare context, failing to report potential compliance issues could have significant regulatory implications under statutes like the False Claims Act or HIPAA, depending on the nature of the risk, and could expose the organization to penalties. Another incorrect approach would be to conduct a superficial follow-up without independently verifying the effectiveness of the proposed corrective actions. This demonstrates a lack of due professional care and a failure to ensure that the identified risk has been adequately mitigated. The internal auditor has a responsibility to follow up on significant findings to determine if corrective actions have been implemented and are effective. The professional reasoning process for similar situations should involve a clear understanding of the internal audit charter, the IIA standards, and relevant healthcare regulations. When faced with pressure to alter audit findings, the professional should first document the pressure and the rationale for their proposed reporting. They should then consult their direct supervisor or the head of internal audit. If the issue persists, escalation to the audit committee or board of directors, as outlined in the audit charter, is the appropriate next step to ensure the independence and integrity of the audit function. The ultimate goal is to ensure that risks are appropriately identified, reported, and managed, thereby protecting the organization and its stakeholders. Question 16. Cost-benefit analysis shows that a new, advanced financial statement modeling software could significantly improve forecasting accuracy and operational efficiency for a healthcare organization. However, the implementation requires substantial upfront investment in software, hardware upgrades, and extensive staff training. The organization is under pressure to demonstrate immediate cost savings. Which of the following implementation strategies best balances the potential benefits with the imperative for accuracy and regulatory compliance? Option A. Expedite the full organizational rollout of the new software to achieve projected cost savings as quickly as possible, deferring extensive validation and advanced training until after the initial deployment. Option B. Implement the new software with minimal initial training, relying on vendor support and on-the-job learning to manage the transition, to reduce immediate training costs. Option C. Focus solely on the initial software purchase price in the cost-benefit analysis, assuming that the projected efficiency gains will offset any unforeseen implementation or operational challenges without a detailed plan for validation or training. Option D. Prioritize a phased implementation, starting with a pilot program in a specific department, focusing on thorough data validation and comprehensive user training before a full organizational rollout, while acknowledging the longer realization of full cost savings. The correct answer is D. Prioritize a phased implementation, starting with a pilot program in a specific department, focusing on thorough data validation and comprehensive user training before a full organizational rollout, while acknowledging the longer realization of full cost savings. Explanation. This scenario presents a common implementation challenge in financial statement modeling within the healthcare industry, specifically concerning the adoption of a new, sophisticated forecasting software. The core challenge lies in balancing the potential long-term benefits of enhanced accuracy and efficiency against the immediate costs and risks associated with implementation. Professionals must navigate this by prioritizing regulatory compliance and ethical considerations, ensuring that the chosen modeling approach not only meets financial objectives, but also adheres to the stringent requirements of healthcare financial management. The correct approach involves a phased implementation strategy that prioritizes data integrity, user training, and robust validation processes before full-scale deployment. This aligns with the ethical obligation of healthcare financial professionals to ensure the accuracy and reliability of financial information, which directly impacts patient care and organizational sustainability. Regulatory frameworks, such as those governing healthcare financial reporting and compliance, implicitly demand a cautious and thorough approach to financial systems that could influence resource allocation and operational decisions. This method minimizes the risk of introducing errors into critical financial statements and ensures that the modeling outputs are trustworthy and defensible. An incorrect approach would be to rush the implementation to realize cost savings quickly, bypassing essential validation steps. This could lead to inaccurate financial projections, potentially misrepresenting the organization's financial health. Such a failure would violate the ethical duty to maintain professional competence and due care, as it prioritizes speed over accuracy. Furthermore, it could contravene regulatory expectations for sound financial management and reporting, potentially leading to compliance issues if decisions are made based on flawed data. Another incorrect approach would be to adopt the new software without adequate staff training. This would result in underutilization of the software's capabilities and an increased likelihood of user error, compromising the integrity of the financial models. This demonstrates a lack of due diligence and could be seen as a failure to uphold professional standards of competence, as it does not equip the team with the necessary skills to operate the new system effectively. Finally, an incorrect approach would be to solely focus on the initial purchase price of the software, neglecting the total cost of ownership, including implementation, training, and ongoing maintenance. This narrow financial perspective fails to consider the long-term implications for the organization and could lead to a suboptimal investment decision, potentially impacting the organization's ability to meet its financial obligations and serve its patient population. This reflects a lack of comprehensive financial stewardship, a core ethical responsibility for healthcare financial professionals. The professional decision-making process should involve a thorough risk assessment, a detailed evaluation of the total cost of ownership versus projected benefits, and a commitment to a structured implementation plan that includes rigorous testing and validation. Professionals must always prioritize the integrity of financial data and adhere to all applicable regulatory and ethical guidelines. Question 17. Consider a scenario where a hospital has provided extensive patient care services during the last week of a fiscal quarter. The billing department has not yet submitted claims for these services to various third-party payers, including Medicare, Medicaid, and commercial insurers, due to the volume of work and internal processing timelines. The Chief Financial Officer, CFO, is eager to report strong quarterly revenue and suggests recognizing revenue for all services rendered during that week, even though the claims have not been filed and reimbursement is not yet assured. What is the most appropriate regulatory compliant approach for recognizing this revenue? Option A. Recognize revenue for patient services rendered during the last week of the quarter based solely on the completion of the patient's visit, without considering specific payer contractual terms or the likelihood of reimbursement. Option B. Recognize revenue for all patient services rendered during the last week of the quarter immediately, regardless of whether claims have been filed or reimbursement is assured. Option C. Recognize revenue for patient services rendered during the last week of the quarter only when those services have been rendered and the hospital has a legal claim to payment, considering the terms of payer contracts and the likelihood of collection. Option D. Defer recognition of revenue for all patient services rendered during the last week of the quarter until cash payments are received from the third-party payers. The correct answer is C. Recognize revenue for patient services rendered during the last week of the quarter only when those services have been rendered and the hospital has a legal claim to payment, considering the terms of payer contracts and the likelihood of collection. Explanation. This scenario presents a professional challenge because it requires a healthcare financial professional to navigate the complex interplay between generally accepted accounting principles, GAAP, and specific healthcare regulatory reporting requirements, particularly concerning revenue recognition for services rendered but not yet billed. The pressure to present favorable financial results can tempt an organization to prematurely recognize revenue, which, if not aligned with strict regulatory guidelines, can lead to misstatements and noncompliance. Careful judgment is required to ensure that financial reporting accurately reflects the economic substance of transactions while adhering to all applicable rules. The correct approach involves recognizing revenue for patient services only when earned and realizable, which in this context means when services have been rendered and the organization has a legal claim to payment. This aligns with the accrual basis of accounting and specific healthcare revenue recognition principles that emphasize the transfer of control and the probability of receiving economic benefits. Adhering to these principles ensures that financial statements are not misleading and comply with regulatory reporting standards, such as those mandated by the Centers for Medicare and Medicaid Services, CMS, for providers participating in federal programs, and general GAAP principles for fair presentation. An incorrect approach of recognizing revenue for all services provided, regardless of billing status or the likelihood of collection, fails to adhere to the principle of realizability. This can lead to an overstatement of revenue and assets, violating GAAP requirement for financial statements to present a true and fair view. Furthermore, it may contravene specific healthcare regulations that require accurate reporting of patient accounts receivable and bad debt, potentially leading to penalties or audit findings. Another incorrect approach, that of deferring revenue recognition until payment is received, is also problematic. While it errs on the side of conservatism, it violates the accrual basis of accounting, which dictates that revenue should be recognized when earned, not when cash is received. This can lead to understating revenue and assets in the current period, misrepresenting the organization's financial performance and position. A third incorrect approach, which involves recognizing revenue based solely on the completion of a patient's visit, without considering the specific contractual arrangements with payers or the likelihood of reimbursement, also presents issues. While the service is rendered, the realizability of revenue is contingent on factors such as payer approval, adherence to billing requirements, and the absence of contractual denials. Failing to account for these factors can result in premature revenue recognition and subsequent write-offs, impacting the accuracy of financial reporting. Professionals should employ a decision-making framework that prioritizes understanding the specific revenue recognition criteria under both GAAP and relevant healthcare regulations. This involves analyzing contractual agreements with payers, assessing the probability of collection, and ensuring that all documentation and billing requirements are met before recognizing revenue. When in doubt, consulting with legal counsel or accounting experts specializing in healthcare finance is crucial to ensure compliance and ethical reporting. Question 18. System analysis indicates that a healthcare organization is considering the adoption of a new advanced diagnostic tool. The finance department is tasked with assessing its value to the organization. Which of the following approaches would best align with current healthcare financial professional standards and regulatory expectations for value assessment? Option A. Focusing the assessment primarily on the initial purchase price and direct operational costs of the diagnostic tool, comparing these against projected revenue increases. Option B. Relying on informal feedback from a few key department heads and a review of existing departmental budgets to determine the tool's overall value. Option C. Prioritizing the evaluation based on the potential for increased billing and reimbursement opportunities, with secondary consideration given to physician testimonials. Option D. Conducting a comprehensive value assessment that integrates clinical effectiveness data, patient-reported outcomes, and an analysis of potential downstream cost savings and revenue enhancements. Correct answer is D. Conducting a comprehensive value assessment that integrates clinical effectiveness data, patient-reported outcomes, and an analysis of potential downstream cost savings and revenue enhancements. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare finance where the perceived value of a service or technology is subjective and can be influenced by various stakeholders with differing priorities. The professional challenge lies in moving beyond simple cost, accounting to a more comprehensive understanding of value, which encompasses clinical outcomes, patient experience, and economic impact. This requires careful judgment to balance financial sustainability with the delivery of high-quality, patient-centered care, all while adhering to regulatory expectations for financial transparency and responsible resource allocation. Correct approach analysis. The correct approach involves a multifaceted value assessment that integrates clinical effectiveness data with financial analysis and patient-reported outcomes. This aligns with the principles of value-based care, which is increasingly emphasized in healthcare regulation. By considering how a new diagnostic tool impacts patient outcomes, reduces downstream costs, e.g., fewer hospital readmissions, less need for invasive procedures, and improves patient satisfaction, the organization can build a robust case for its adoption that goes beyond its initial purchase price. This comprehensive view is essential for demonstrating responsible stewardship of resources and for meeting the evolving expectations of payers and regulatory bodies that are shifting towards rewarding value rather than volume. Incorrect approach is analysis, an approach that focuses solely on the initial acquisition cost and direct operational expenses fails to capture the full economic and clinical value of the diagnostic tool. This narrow financial perspective ignores potential long-term savings and improvements in patient care, which are critical components of value assessment. It also risks overlooking opportunities to enhance patient outcomes and satisfaction, potentially leading to a suboptimal investment decision and a failure to meet the organization's mission. An approach that prioritizes only the potential for increased revenue generation without a thorough evaluation of clinical efficacy and patient benefit is ethically problematic and potentially non-compliant. While revenue is a factor, it cannot be the sole driver of value assessment, especially when patient well-being is at stake. This approach could lead to the adoption of technologies that are not clinically superior or that do not offer genuine value to patients, potentially misallocating resources and undermining patient trust. An approach that relies exclusively on anecdotal evidence from a few physicians or departments, without systematic data collection and analysis, lacks the rigor required for sound financial and clinical decision-making. Anecdotal evidence can be biased and may not represent the broader impact of the diagnostic tool across the patient population. This approach fails to provide objective data to support the value proposition and could lead to decisions based on incomplete or skewed information, which is a failure in professional due diligence. Professional reasoning. Professionals in healthcare finance must adopt a decision-making framework that moves beyond traditional cost accounting to embrace value-based principles. This involves 1. Clearly defining what constitutes value in the specific context of the healthcare service or technology being assessed, considering clinical, economic, and patient experience dimensions. 2. Systematically collecting and analyzing relevant data from multiple sources, including clinical trials, real-world evidence, patient surveys, and financial records. 3. Engaging a multidisciplinary team, including clinicians, financial analysts, and patient advocates, to ensure a holistic perspective. And 4. Evaluating the potential adoption against strategic organizational goals and regulatory requirements, ensuring that decisions are both financially sound and ethically responsible. Question 19. Stakeholder feedback indicates a growing concern regarding the organization's cybersecurity posture and its ability to protect sensitive patient data from increasingly sophisticated threats. Given the limited budget for the upcoming fiscal year, which of the following approaches best addresses these concerns while adhering to U.S. healthcare regulations? Option A. Implement security controls only in response to specific reported security incidents to demonstrate a reactive but cost-effective security strategy. Option B. Conduct a comprehensive cybersecurity risk assessment to identify critical vulnerabilities and prioritize investments in security measures that directly mitigate the highest impact risks to patient data and operational continuity. Option C. Defer significant cybersecurity investments until the next budget cycle, focusing only on essential IT maintenance to manage immediate operational costs. Option D. Focus cybersecurity spending exclusively on meeting the minimum compliance checklist mandated by current regulations, without considering industry best practices or emerging threats. Correct answer is B. Conduct a comprehensive cybersecurity risk assessment to identify critical vulnerabilities and prioritize investments in security measures that directly mitigate the highest impact risks to patient data and operational continuity. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing immediate operational needs with long-term cybersecurity resilience and regulatory compliance. Healthcare organizations handle highly sensitive patient data, making them prime targets for cyber attacks. A failure to adequately address cybersecurity risks can lead to significant financial penalties, reputational damage, and most importantly, compromised patient safety and privacy. The pressure to maintain service delivery can sometimes overshadow the necessity of robust security measures, creating a conflict that demands careful judgment and a strategic approach. Correct approach analysis. The correct approach involves a comprehensive risk assessment that prioritizes vulnerabilities based on their potential impact on patient care, data privacy, and operational continuity, followed by the implementation of a layered security strategy. This aligns with the principles of the Health Insurance Portability and Accountability Act, HIPAA, security rule in the U.S., which mandates that covered entities conduct risk analyses to identify and address potential vulnerabilities to the confidentiality, integrity, and availability of electronic protected health information (EFI). A proactive, risk-based approach ensures that resources are allocated effectively to mitigate the most critical threats, thereby safeguarding patient data and maintaining operational integrity in compliance with regulatory requirements. Incorrect approaches analysis. Prioritizing immediate cost savings over cybersecurity investments is a significant regulatory and ethical failure. This approach directly contravenes HIPAA mandate to implement reasonable and appropriate security measures. It creates a false economy, as the cost of a data breach or ransomware attack far outweighs proactive security spending. Ethically, it demonstrates a disregard for patient privacy and safety. Focusing solely on compliance with minimum regulatory requirements without considering emerging threats or best practices is also insufficient. While HIPAA sets a baseline, it is not a static standard. Cybersecurity threats evolve rapidly, and a reactive, minimal compliance approach leaves the organization vulnerable to sophisticated attacks that may exploit gaps not explicitly covered by current regulations. This can lead to breaches and subsequent penalties, as regulators expect organizations to act in a manner consistent with industry best practices to protect sensitive data. Implementing security measures only after a security incident has occurred is a reactive and unacceptable approach. This demonstrates a failure to conduct adequate risk assessments and implement preventative controls, which is a core requirement of HIPAA. Such a delay in security implementation significantly increases the likelihood and impact of breaches, exposing the organization to severe financial penalties, legal liabilities, and irreparable damage to patient trust. Professional reasoning. Professionals in healthcare finance must adopt a proactive and risk-based approach to cybersecurity. This involves understanding the regulatory landscape, e.g., HIPAA in the U.S., conducting regular and thorough risk assessments, and prioritizing security investments based on potential impact. Decision-making should be guided by a framework that integrates financial prudence with ethical responsibility and regulatory compliance, ensuring that patient data and operational integrity are protected against evolving cyber threats. Question 20. The efficiency study reveals that the actual cost of a specific patient care procedure exceeded the standard cost. Which of the following interpretations of this variance best aligns with the principles of responsible healthcare financial management? Option A. The variance requires a detailed investigation into the underlying causes, considering factors such as changes in patient acuity, the implementation of new treatment protocols, or regulatory compliance requirements before determining appropriate action. Option B. The variance is an inherent characteristic of healthcare delivery and should be accepted as a normal fluctuation without further analysis or intervention. Option C. The variance indicates a failure in operational efficiency and necessitates immediate cost-cutting measures to bring expenses back in line with the standard. Option D. The variance suggests that the standard cost was set too low and needs to be revised upwards to reflect current operational realities and patient care needs. The correct answer is C. The variance indicates a failure in operational efficiency and necessitates immediate cost-cutting measures to bring expenses back in line with the standard. Explanation. This scenario presents a professional challenge because it requires interpreting standard costing variances within the context of healthcare financial management, where patient care quality and regulatory compliance are paramount, not just cost reduction. The pressure to demonstrate financial efficiency must be balanced against the ethical and regulatory obligations to provide appropriate care. Careful judgment is required to distinguish between genuine inefficiencies and necessary deviations that support patient well-being or comply with evolving healthcare regulations. The correct approach involves a nuanced interpretation of variances, recognizing that deviations from standard costs are not inherently negative. It requires investigating the root causes of variances, considering factors beyond simple labor or material overruns. This includes assessing whether increased costs are attributable to improved patient outcomes, the adoption of new, more effective, though potentially more expensive treatment protocols, or necessary compliance with updated healthcare regulations. This approach aligns with the ethical imperative to prioritize patient care and the regulatory requirement to adhere to all applicable healthcare laws and guidelines. It fosters a culture of continuous improvement by identifying opportunities for efficiency without compromising quality or compliance. An incorrect approach that focuses solely on identifying and eliminating cost overruns without considering the underlying reasons is professionally unacceptable. This could lead to cutting corners on patient care, neglecting necessary equipment upgrades, or failing to implement mandated safety protocols, all of which carry significant regulatory and ethical risks. Another incorrect approach that attributes all unfavorable variances to staff performance without investigating systemic issues or external factors ignores the complex operational realities of healthcare. This can lead to demoralized staff, unfair performance evaluations, and a failure to address the true sources of inefficiency, potentially violating labor laws and ethical management practices. A third incorrect approach that dismisses any variance as unavoidable due to the inherent unpredictability of healthcare overlooks the responsibility of financial professionals to identify and manage costs effectively. This abdication of responsibility can lead to unchecked spending and financial instability, which ultimately impacts the organization's ability to provide care. Professionals should employ a decision-making framework that begins with a thorough investigation of all significant variances. This involves gathering data from clinical and operational departments, consulting with relevant stakeholders, and understanding the specific context of each deviation. The analysis should then evaluate the impact of the variance on patient care, quality, and regulatory compliance. Finally, decisions regarding corrective actions should be made based on a comprehensive understanding of these factors, prioritizing patient well-being and regulatory adherence while seeking sustainable financial improvements.